the number one issue on my list, it starts with great leadership. Without great leadership, in our experience, nothing else matters.
Welcome to Rural Health Today. I'm JJ Hodshire, President and Chief Executive Officer of Hillsdale Hospital, and this is a podcast where we connect you, the listener, to what really matters the most in rural health. I'm excited to introduce today's special guest, Brian Peters, Chief Executive Officer of the Michigan Health and Hospital Association. Brian, back in the studio.
JJ, it is always wonderful to be with you here at Hillsdale Hospital and back in studio. Thanks for having me.
Absolutely. Brian, it's always an energetic time. Whenever I'm around you, we're going to talk a little bit about some of the work that you're doing. But just first and foremost, thanks for driving to Hillsdale. A lot of folks like to do this over Zoom or Squadcast, but it's always great to have you in the studio. You get to see some of your member hospitals, and you've been to Hillsdale numerous times. Even before I was here with Duke Anderson and Chuck Bianchi, probably even before that.
That's right.
So you have a long history, and we're going to get into your history, but it's always a pleasure to have you walk the campus. It is.
Well, thank you. It's actually one of the favorite parts of my job, to be very honest, the opportunity to get out in the field and see our facilities, but more importantly, to spend time with the amazing people that work in those facilities. That's really where the magic happens and why I'm so proud to have the job that I have. And it's an honor to work with amazing leaders like you, JJ. Well,
you're one of the best CEOs I've ever worked with, and I'm going to talk about that at the end of my podcast, and I mean that sincerely, and Kirsten can attest to the fact that I don't say that every time I have a CEO in my studio, but it is always great, and we're going to pick your brain today. We have a lot of issues we have to tackle, Brian, a lot of issues that are very deep, emotional, concerning, and a lot of decisions that are being made over the next few weeks and maybe months that are going to impact the lives of millions of Americans across this country. And you're right there, and you're trying to head off some of the dangerous legislation that's being proposed. And we're going to talk about that, but I just appreciate your hard work. But someone may be listening across the country and go, what in the world does a CEO of an association do? Is it something fun? Is it tough? I can tell you it's a difficult job, but for those who may not know, tell us a little bit about your role at the MHA. How long have you been there? What do you do? And then we're going to get into the specifics of what the Hospital Association does. But start by telling us a little story about yourself.
Well, thanks, JJ. And it really is an amazing opportunity to work at the Michigan Health and Hospital Association. I've been there for 35 years now. I started as an intern.
At 10 years of age, yes, absolutely.
I was a bit older than that, but was given a great opportunity by the former CEO of MHA, Spence Johnson, who was actually the CEO when he retired for 30 years at the association. So really an icon in the field, even at the time that he brought me on, and I had the opportunity to work with him and with the amazing team at the MHA. Yeah. But to answer your question, the MHA is a really amazing organization. We have the great privilege to represent literally every hospital and health system throughout the entire state.
I think that's an important fact to point out to our friends listening across the country, is that we are one that we believe, and we firmly believe this, that we are the only, at this point, hospital association has 100%, 100% participation.
It is extremely rare, and it's not just a one-off. That's something that has been a real integral part of our organization for years. In fact, we have had 100% membership for the entire 10 years that I've had the privilege of serving as CEO. We've never lost an acute care community hospital or health system member, and I think it speaks to the value that we're able to deliver to the field on an annual basis. And so our association, we are an advocacy organization first and foremost. As you alluded to, all of these issues that are under consideration at the federal level in Washington, D.C., certainly everything that's happening in Lansing, both in the congressional scene, but also in the state legislative arena, but also in the courts. We file anywhere from half a dozen to a dozen amicus briefs in the court system, mainly focused on medical liability, but certainly other issues as well. But we also get involved in the regulatory space as well. So things that come from the administration, DHS, in Lansing or CMS at the federal level, we engage there. So that's the advocacy arm. We also have a 501c3 nonprofit arm, which includes the MHA Health Foundation. We administer grants on behalf of our members. We also have the MHA Keystone Center, which is a 501c3 nonprofit. It has garnered national and even international acclaim for the patient safety and quality improvement work that we've done. Hillsdale Hospital, from the inception of the Keystone Center, has been an active participant and really has benefited in that shared learning.
Absolutely, we have.
And then the third leg of our three-legged stool, if you will, is the MHA Service Corporation. That's our for-profit arm, and we have in-house data services, which
incredible.
We provide data to all of our members and to academic researchers as well. In-house unemployment compensation program that we provide to hospitals.
Very beneficial.
And actually some clients outside of healthcare as well.
Yeah.
And then we have an endorsed business partner program. So currently, about a dozen organizations that do business with our hospital and health system members from multiple focal points. And that's been a very helpful and instrumental part of the association for about the last 10 years now. So we're an association that helps our members in many different ways, and we have a long track record. We just celebrated our 100-year anniversary just before the COVID-19 pandemic. So we've been around for a while, and we intend to be here for the long haul. We're committed to creating value for our members.
Yeah, there's two great reasons why you have 100% hospital participation. And I say this with sincerity. Number one is leadership. You have demonstrated, you have steadied the ship through some very difficult storms. And I'm going to ask you a question in a minute about, tell us something fun about yourself, and I hope it has something to do with steadying ships, but maybe not, but we'll find out. Number two is value added to the member hospital. And this is where, I can attest firsthand to the value added, whether it's data reporting, seminars, conferences, resources, whatever it is. Biggest part, advocacy, which we're going to talk about in a minute, but you left one out, print shop. Don't forget that Hillsdale Hospital, we just had some work done in some banners that were made. Beautiful, absolute beautiful job that you've done in providing your members with access to resources that we otherwise would have maybe been getting from another state, another country. And so it's really great to see all of the work that you have done to build up MHA for the purpose of reducing the burden of dues to the member hospitals. And I think that's a success, is that, we're not burdened with heavy dues. Very minuscule if you consider the return on investment, because just the fact of the work that you've done over the last decade with the legislature to keep harmful legislation out of our hospitals, our dues have been paid back to us 10 million fold, without a doubt. So two good reasons, leadership and value added. Don't forget that.
Well, appreciate that, JJ. And we really do pride ourselves on the return on investment. There's no question. We look at every one of our members on an annual basis. What have they paid in dues, and what have we been able to deliver to them that's tangible, that we can actually attach real financial value and value in terms of access to the communities that they serve. You mentioned the print shop, and I remember there was a point in time where we were gravitating away from printed materials, right? Because the world was moving to an electronic format, and we were shifting from a printed and mailed MHA weekly report that went out the door to all of our members, and we shifted to an electronic emailed approach. And of course, we developed a website and all of that, but we had a key leadership decision before us, which was, okay, understanding the way the world is moving, we can either eliminate that graphic design and print shop operation altogether, or we can keep that in-house, but look to broaden our focus and bring in clientele from our membership and from outside our membership. And in fact, we have a full-time sales lead whose job is to develop that business. And to your point, JJ, it's not only given us a tool in the toolbox to help our members like Hillsdale, we appreciate your business in that regard, but also to minimize the need for dues increases. And when we benchmark ourselves against our colleagues across the country in the State Hospital Association realm, we believe that we fare very well.
I would agree with you, absolutely, for all the above reasons. And so, Brian, the work you're doing, stellar. We're going to jump into some of that work that you've been engaged in over the last few months. but to humanize this podcast a little bit. Folks may be listening from Montana, like, who's this Brian Peters guy? He sounds intelligent. He is, but humanize us a little bit. Tell us a fun fact about yourself before we get started with the interview today. Maybe something that, you've cherished, something that you've done. Maybe it has something to do with rural life, maybe not, who knows? But why don't you talk to us a little bit about a fun fact?
Well, I'm smiling because my backstory in terms of how I came to the MHA absolutely relates to rural.
Yeah, it does.
In a very significant way. So I was actually an undergraduate at Michigan State University, earning my bachelor's degree in business administration. But during the summer, I spent in Charlevoix, Michigan, which is a small rural community on the shores of Lake Michigan, actually home to a critical access hospital, a Charlevoix area hospital, now part of the Munson system.
Yeah, absolutely.
And I had spent my summers in Charlevoix since I was a little kid. So I grew up with all of my best memories in a very rural part of the state. But one of my clients, as it turns out, when I was running a sport fishing charter service there during my college days, was Spence Johnson, the great MHA leader that I mentioned.
So you're in college, you're running these to earn some extra cash and enjoying life, all right? And Spence Johnson, he walks on your boat.
He comes onto the boat with his sons and came back every summer. He must have enjoyed salmon fishing and lake trout fishing with me. And at the end of my MSU undergrad days, he actually offered me an internship at MHA. And long story short, I said yes, and I fell in love with it. I fell in love with the mission and the people, both on staff and in the membership, and really wanted to stay on board after the internship was over. And he recommended that I go back to school and earn a master's degree in health services administration. Well, it turns out the top-ranked program in America happened to be 45 minutes down the road in Ann Arbor, University of Michigan. Yeah. So I went through the master's in health services administration program there, but have been at MHA, as I said, for 35 years.
It's incredible.
Continue to go back to Charlevoix, and we've raised our two kids who are now grown adults, but they have spent a tremendous amount of time with us in Charlevoix on the nature trails, out on the water, and have some of our most amazing memories.
It's incredible, isn't it?
In that place.
Yeah. Well, fun fact for me, 50 years of age and first boat ride I ever had, officially like that, was yours last year. And it was phenomenal. Did not die, scared to death. But then I got on your boat and it's like, well, this is easy. And beautiful day, beautiful conversation. So, Brian, obviously your passion 30 years ago, obviously still continues today. And what I want to do is talk a little about state government and then get into some federal issues if we could today.
Absolutely.
But today we're talking about what it means to lead an association and equipping hospitals and healthcare organizations to serve their communities. We'll talk about the current healthcare challenges, overcoming obstacles, and of course, what it all has to do with rural health, the purpose of our podcast. So understanding a little bit about the background of MHA, which you just shared and we appreciate, take us through the journey about what the MHA does with the Michigan legislature as it relates to healthcare. And I think it's important to advocate that sometimes it even extends beyond healthcare in certain areas. But let's talk a little bit about, let's start at the state level, the representation that you do as an association for state of Michigan hospitals.
Absolutely. And we've been advocating with the state legislature and the governor and their administration for many, many years, decades. And when I first came to MHA as an intern, we actually had a single office for our MHA staff, and it was on the west side of Lansing, not very convenient at all to the state capitol building or the House and Senate office buildings or the governor's office, none of that. Long story short, we really believed we needed to have seats on the 50-yard line, and so we secured space. It's now known as the MHA Capitol Advocacy Center. It is literally right across the street from the state capitol building. Best view of the capitol in town, I have to say. We, in fact, host a number of political fundraising events right there in that space, both Republican and Democrat alike, because it's such an amazing location. We also, about 10 years ago, decided that we were going to sublet space in that Capitol Advocacy Center to our hospital and health system lobbyists. And so we now have created this cadre of healthcare leaders
Yeah.
that are housed under one roof. We're all together. When things really start amping up in the Capitol building, we can quickly assemble, compare notes. It's worked out very, very well. So we really engage on a daily basis with our elected officials in Lansing. Now, sometimes that's when the legislature is in session and we're attending committee hearings and the like and providing testimony. Maybe we're conducting an office visit with an individual member of the State House or Senate and letting them know about our priority issues. Other times, that's attending their political fundraisers, maybe in Lansing or back in their home district. Yeah. Sometimes that's accompanying our hospital leaders on a hospital site visit with an elected official, which, by the way, we think is incredibly impactful and important now more than ever. They need to see firsthand how the decisions they make, whether that's a funding decision or whether that's a policy decision, directly impacts your ability to provide care to your community. And so we help to facilitate all of those things. Now, we have what is one of the largest independent political action committees in Michigan, MHA Health PAC. Yeah. And that is a very important component of the public policy and political ecosystem. Whether you like it or not,
it's needed.
It is needed. In this environment, you need to support healthcare champions. Either those who are seeking office for the first time or those who have demonstrated their support for healthcare. We need to help them in their path to get reelected and stay in office. So Health PAC has become an important component for us as well. But at our Downtown Capital Advocacy Center, JJ, we not only have our day-to-day lobbyists on staff, we also have our communications team and our policy team. So that three-legged stool that works so closely together when we're conducting site visits or media roundtables or preparing for testimony before the legislature. Those are the tip of the spear, if you will, in terms of that work. And so that's the nature of what we do on a daily basis.
Tremendous amount of work in the background that you do. I mean, it's ranging from communicating with key leaders, with pivotal leaders, with tiebreakers, and there's a lot of what we would say backroom function that goes on with MHA that folks never see. And you could spend literally years on an issue or a subject, which we know we'll talk about 340B in a minute, but there's so much that's done in the background. Your staff are flying to D.C., they're flying, across the country, having conversations with AHA, et cetera. But what I want to know, and for those listening maybe in other states who say, why should we join our association? Talk to us about the communication back to your member hospitals. So you worked recently on ESTA, Earned Sick Time Act. You led it, Michigan Hospital Association did, because we were lost as employers. And, the importance of a committee that you formed, the Human Resource Committee, HR, and having that group of individuals, talented leaders led by your organization leadership, put together seminars, training, education. But when you are working in the backdrop, it's kind of like the unsung hero. You don't hear from them all the time or see them because they're busy doing the work. How do you communicate that back then to your membership?
What you're really alluding to, JJ, and it's a core element of our association, is shared learning. So there's the advocacy in the legislature that we discussed. This shared learning, in many respects, is just as important because we have such a large and diverse membership. We have 134 hospitals all throughout the state of Michigan. Some are independent, some are system-based, some are investor-owned, some nonprofit, some rural, some urban, some academic medical centers. It is a very diverse membership. And over the years, I can see so many examples of where we learn from each other. And someone has developed an approach to a problem that seems to be creating good results. Well, let's share that. Yes, we compete with each other in the marketplace for market share, for physicians and nurses and all that. But the MHA is a safe place. It is. It's a safe table where we can actually rise the tide for all ships, as the expression goes. That's really what we're all about. And so you think about some of these issues like the Earned Sick Time Act, and I reflect on the fact that back when I came to MHA, again, many years ago, our only point of intersection in our hospitals and health systems was with the CEO.
Right.
Over time, what's changed is that we've been very intentional about developing formal relationships with just about every other element of your organization. You mentioned the Human Resources Council. So we bring together the HR leaders. We have a chief medical officer group. We have a chief nursing officer group. We have been conducting meetings with our supply chain leaders for quite some time.
The list goes on and on.
The list goes on and on. And so I think that's given us the depth that any time a new issue evolves, we're not starting from scratch. ESTA comes forward.
Right.
Well, we already have relationships established with the HR leaders in our membership, so we can quickly convene them. And at the same time, on that topic, we joined a coalition of like-minded organizations, including the Michigan Chamber of Commerce. Give them a lot of credit for their leadership on this issue as well, where we had something in common. Well, let's again share our wisdom with each other, but also advocate to our elected officials together, hand in hand. Hey, as employers, whether we're a manufacturing firm or a hospital, here's something we have in common. We want to raise this concern together.
Absolutely.
And that's, I think, a great example of where we can make a difference.
It's an amazing example. And Brian, so let's talk a little bit about, so you do a lot of heavy lifting, but you can't do it all. And you rely on your member hospitals, but you have to empower them. So talk to us about, you're not only that training place and that convener, but, empowering local hospitals. How important is that they also are out there speaking? It just can't be you, right?
It's incredibly important because you're right. We are a small organization. At the end of the day, we only have 100 employees at the MHA. It's a big state, 10 million people in the state of Michigan.
Yeah.
And so, JJ, you make a great point. It's why we believe this partnership with our members is so critically important. We try to develop talking points. We try to collect data. We try to bring in consultants who have expertise on the issues. But then, to your point, we really do try to share that information with our members and encourage them to intersect with the Lions Club and the local Chamber of Commerce and with certainly their elected officials, with the media. That's where we have a role to play as a facilitator, as a resource for information and data. But you're exactly right. We can't do it on our own. This is a partnership at the end of the day.
Agree. You've been around a while. I'm not going to say a long time. That's I'll say that in 30 more years when you're interviewing here with me. But you've been around a while, and you have certainly seen a lot of challenges, a lot of successes. You've shared in those successes. You've led those successes. The challenges you've witnessed. We'll talk about in just a minute about hospitals that haven't made it. That's always a very difficult time in a rural community when that's usually represents second or third largest employer. But, I guess as you look at it, for someone listening across the country, not just specifically to Michigan, I want you to look beyond Michigan, but use your Michigan experience. In your historical perspective and in the work that you've done, what do thriving hospitals have in common? And I guess what do you typically see as in that hospital? What do you see as the synergy and the leadership and the direction? What defines that success? Because a lot of our hospitals right now are asking the question, how are we going to make it? And that was before we talk about Medicaid cuts, Brian.
Well, to your point, JJ, in the 1980s, here in the state of Michigan, we had 240 hospitals. We have 134 today. Yeah. And so you're exactly right. We have seen a significant number of hospital closures throughout the state of Michigan, and certainly this is not unique to our state. This is a national phenomenon. And if you project into the future, that risk of closure, that risk of service line reduction or elimination is even more acute in the rural parts of our state and the rural parts of our country.
Right.
And so it's a real concern. To answer your question, though, I think there are a number of components here that are important. In my experience, as we've had this bird's eye view over the field, and that's one of the real benefits of being at the MHA is you have this opportunity to watch and observe and visit and learn from such a diverse membership. The number one issue on my list, it starts with great leadership. I'm looking at a great leader here. JJ,
thanks,
you are doing something that is remarkable here in Hillsdale. And so that leadership comes first. Without great leadership, in our experience, nothing else matters. It's not going to work if you have the wrong person that is setting the tone, creating the right culture, creating the right vision for the organization and the community. That really is incredibly impactful. I think there's also a real important element here that the community rallies behind the organization and understands just how critical healthcare is. And we always lift up the fact that, yes, there's the access to healthcare services in and of itself. That's critically important.
Convenient.
But you think about the economic engine element of hospitals, particularly in rural communities where they're often the largest employer, one of the largest employers. You think about a manufacturing plant that might consider locating in a community. How are we going to recruit and retain talent if our employees don't have a place to go for emergency care or for this service or that service? So having a hospital, a vibrant hospital in a community is so critically important. That's why the community has to rally.
Agreed.
And again, it gets back to leadership, though. A great leader is able to tell that story and is able to rally support for the organization. In the communities where that hasn't happened, that's where bad things happen.
And you see it. You do. You really do. So, we also understand that as CEOs, yourself included, man, we're busy. We get bogged down with a lot of day-to-day activities that really takes our time. In fact, since we've been in the studio, I've received at least 5 different text messages coming in and 3 phone calls, which you've watched me silence. Chief of medical staff, I got 2 other physicians after me right now. No idea what they want. And so into the day, we seem like we're just, moving pieces around in our hospitals. But for the CEO listening today that understands they have to go beyond that, how do they get involved? What is the first step for a CEO who says, I got to move beyond just moving the pieces around here and advocate. And I want you to put it towards a specific eye, rural health, because that's where I come from. And I really want to focus on that. It's the focus of this podcast. How does that rural CEO accomplish that?
Well, first off, JJ, it's a great question. I think whether you're the CEO of a rural hospital or the CEO of MHA or the CEO of any organization for that matter, there is this difference between, as I say, responding to your inbox versus leading from your outbox. So responding to your inbox is like that game of whack-a-mole, and you could literally wake up in the morning and spend all day doing nothing other than responding to those texts and emails and phone calls that come in to you. Well, that's an important part of the job, and you can't ignore those things. Don't get me wrong. And you could fill your day with that. But if that's all you're doing, then I don't think you're going to be a successful leader.
Agree.
I think that leading from your outbox means you're the one that identifies the issue. You're the one sending the text, the email, the phone call. You're the one that says, hey, here's something that's important. Now I need to rally people around my vision for what we need to accomplish as an organization. So for a rural healthcare leader, I think it's understanding, number one, the state of play. And that is the challenge that we have in rural communities. We tend to be older. We tend to be sicker, according to the data. We know that volume is going to be lower than in a larger urban community. Areas, and that creates unique challenges for rural healthcare provision. And so the traditional volume-driven reimbursement model in healthcare, again, is not perfectly suited to rural health. And so we have to find our way around that and create models that allow us to continue to thrive and create access opportunities for our community. So I think, again, it's having a vision, and that vision can be a little different depending on the realities of the local community. And you know what? Even here in Michigan, I could tell you about all the rural visits that I've been on where the politics may be very different. The nature of the workforce may be very different. The nature of the physical plant and history of the organization may be different. And so it's hard to paint all of our rural members with a single brush because there's a lot of diversity even there.
Yeah.
But again, I think for the leader, it's incumbent upon them to take stock in the situation globally in terms of rural health, take stock of the situation at the local level and all those different dynamics I mentioned, and then chart a course, set the vision, and rally people around that vision.
Well, listeners, you've heard today from a leader who is a visionary leader, someone who is most important, though, a servant leader. And Brian Peters said it the best. It's about vision. And we know from a very, very popular Bible phrase, where there is no vision, the people perish. And there has to be a vision that's cast. That is the job of the CEO. So if you're listening today and you're a CEO, and you're just trying to struggle with how to get that inbox answered, and you're just really struggling to understand your purpose, understand that there is a purpose for you. You can be an advocate and a champion for rural health. Cast that vision. Be that person that, as the president here has said, that has the outbox that's ready to go with meaningful dialogue with you and your staff, and most importantly, your community. So, Brian, let's shift. We're going to get in a round robin here. We got about 4 or 5 key issues that I want to tackle today. And we don't have to spend hours on these issues. I'd love to, but there's a lot of history with these issues. Let's first tackle one that we're hearing a lot about. We have been hearing about it: price transparency. Sounds good. Wow, I'm excited when I hear that. I mean, it gives me shivers. Price transparency. But what does it mean? Is it real? So we post our prices on a website. Does anybody even understand what that means? Is it a correlation of equals? Can you tell us a little bit about what is the impetus, what has been the impetus behind price transparency? What is it? And what are we hospitals doing about it?
Well, absolutely. And there is a history to this. So if you look back in time, healthcare in America, and that includes care delivered in our hospitals, has been a black box in terms of information that the consumer can easily access and digest. And that information, when it comes to hospital care, really falls into 2 general categories. It's information about the quality of care that we deliver. So can you compare a hospital A with hospital B when it comes to things like length of stay or mortality rates or surgical complication rates or bloodstream infection rates, all of those things that we track and measure. And then the second element is price. And you alluded to new public policy, relatively new public policy that really encourages us and requires us to post our charge master online. To your question, is that useful? No. This is not one of those issues because both Republicans and Democrats alike believe that consumers need more information, whether that's price or quality. And so now what's happening is it's almost the Wild West, JJ, where there are a number of entities out there in the field that are collecting this information and sharing it in a public fashion, including Yelp. The same Yelp that you can use to look at your local restaurants and hotels is now getting into hospitals and physicians, right? Yeah. And so the point is, people are trying to build a better mousetrap. This is a train that's left the station, and we're not going back. So we're not where we need to be today.
Right.
I think we have committed as an association that we need to do better, but understand that healthcare is fundamentally different, and understand that not everything qualifies as a shoppable service. In other words,
that's right.
The obvious example is if you're having a heart attack and you're in an ambulance, you're not exactly shopping. Right.
No.
You're heading to the nearest
hospital.
Room.
That's right.
Exactly. And so there are a lot of examples like that.
Yeah.
So healthcare is just fundamentally different in so many respects. Yeah. But at the end of the day, yes, this transparency issue is not going away. And I think there's this issue of steerage that some insurers, including Medicare and Medicaid at some point, are going to want to create steerage. That means incentivizing patients to go to this hospital or this provider.
We see it now with certain plans, but you're absolutely right. And that steerage is what's very concerning.
Right. And so I think this whole question about transparency is very, very relevant. going forward. Now, for rural providers, it takes on a different element as well, because it's not like a city where there are multiple hospitals within walking distance.
Right, you have one within 45 miles.
Right, and so I think the pressure on leaders like yourself to organize a high-quality team and clinicians and provide that care in an affordable way, that pressure is felt even more so.
Yeah, it's very deep, very concerning. If it was end-user information that was relevant and comparable, but it's just not comparable. But
no,
hopefully some reform will happen in the future years, but it's posted. And most hospitals, I would venture to say the majority of hospitals have met the compliance. Those that don't, there's stiff penalties if you do not. So I'm assuming they met the compliance. And then we'll see, I guess, where the data goes from there. And thank you to our listeners for tuning in to Rural Health Today. Catch our next segment, Rural Health News, to stay up to date on the current state of rural health care every Monday, wherever you get your podcasts. Don't forget to check out our latest updates and resources from Rural Health Today at ruralhealthtoday.com, and make sure you've subscribed to the show so that you never miss an episode. Until next time, remember the power of rural.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to our guests for sharing their expertise on the show, and also to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.